people eating sheep brains. However, it is a Scottish dish and, whatever. But I kind of stay away from nervous tissue stuff. Not that I'm not adventurous, but just because you never know if you had some rogue prions in there that you can't cook out that cause mad cow disease, and you wouldn't know for like 10 years down the line as your brain turned into a sponge. And at that point it'd be too late, there'd be nothing you could do about it. So I would suggest staying away from nervous tissue.
You want to explain prions to us and how they work?
Prions and how they work. I don't know if anybody really knows how a prion works, but it's like a protein type thing that tends to not, we don't really know a lot about them, but we know when they're not working right, things that go wrong.
So it's like a deformed protein that we can't
No,
process?
it's not really a deformed protein, because we have them that they do have, we don't, I know they have specific jobs that they do, but we know that was the problem with mad cow disease, is these things they call prions that were rogue. They were not doing their job, and they were very dangerous. So, anyway, let's move on to,
I'm recording for Jess.
I actually read a book, but I didn't know how true it really was.
I don't know if they really do. I don't, I haven't really done any current research in there. I think the last things I read about prions was maybe about 5 or 6 years ago. But, I don't know. Do you have any
Knowledge? No.
probably knows as much as everybody else, or more so, but that we don't know a lot. Here is our brain model, and notice how there's this nice little line that people keep on running their pencil through. And so this is the central, this is the central sulcus, okay? A sulcus, as we're going to see in the movie, is where it sinks in between these noodly parts. These noodly parts are called gyri. Each one is a gyrus. And so it's important to see that this lump in front of the sulcus is called the precentral gyrus, and the lump behind the central sulcus is the postcentral gyrus. Now, you can call them by their anatomical names, the precentral gyrus and the postcentral gyrus, but if you also see over here that the precentral gyrus also goes by another name. It's called the primary motor area. So this spot right here is the primary motor area. And as the name suggests, it's going to have something to do with
Motorcycles.
motorcycles.
I said motor skills.
Motorcycles. Okay, right in your motorcycle. So right here, this is going to help you.
I heard you.
Right.
I haven't recorded.
You might have seen that commercial, that kayak commercial, that for surfing the internet for vacation sites. Did you ever see that kayak commercial? Okay, and the brain surgeon is sitting there poking the patient, and the patient has the computer in front, and he was moving his fingers. Yeah, that's what's happening when you can poke here, and you can make people do things like that, move their fingers, and that is because this is where those are initiated. Over here, our postcentral gyrus also goes by the name of primary somatosensory area. Okay, primary, that's the first. Soma, what does that mean?
Body.
Body. Sensory,
Touch.
sensation, okay? So that is where we feel these things, okay? So if I were to poke you, I don't know, maybe about here, you'd say, ooh, you're poking me in the knee. And I'm like, no, I'm poking you on the brain. But that is where your brain is going to interpret where the sensations are coming from. So if a person, let's say, had their leg amputated, they will still have the parts of the brain that were involved in telling them what they were feeling, okay, involved in localizing sensations. And you would still have the tracks running up their spinal So they might actually sense like, oh, my leg really hurts today, because sensation of pain, that's what you feel in your head. Okay, it's not actually in the leg or the limb, it's actually in the head. So if if the messages are not getting to the head, then you won't have any sensations. Okay, if they, for some reason, the signal is getting there and alerting a side, then we're gonna think that something's happening. We call that phantom pain. Okay, so it's a real thing that people are feeling these things, but they don't have the limb anymore. They've done some really interesting studies on how to help people release that pain that they feel. And one of the weird things that they did was an experiment where they had people that had lost a limb in their, their arm and their hand. And what they did is set them up with mirrors. So whatever they did with the one hand that they still had, their brain was looking in the mirror, thinking that the other arm was responding. So they were able to do these exercises. The brain was assuming it was telling the other hand that it saw in the mirror to do these things, and it helped to relieve some of the pain because of the neurotransmitters releasing some of the neurons releasing some of the neurotransmitters. So it's kind of cool how we can trick ourselves into things and how we get ourselves into messes. But, if it's in the head, it's actually, you're feeling the sensation. So anyway, which term do you use? Do you use the physiological term, primary somatosensory area, or do you use the post-central gyrus? I don't care, okay? Use either one of them. Some of you guys are looking going, yeah, primary somatosensory area, not so much. It's really long. I'm not going to remember all that. So you just call it the post-central gyrus. So you can use either one of these terms, okay, in here. If it's on the sheet, it's fair game, okay? You don't have to put all of it on there. It's not going to all fit. Okay. So one or the other. The other thing that people have a hard time with is this thing, the infundibulum. So if I'm just going to take half of this anyway. As you can see, this little part coming down here, that's the hypothalamus, and this little wire coming off of that hypothalamus, that is the infundibulum. Okay, you see that? That's the infundibulum. What do you think this thing is? It is the pituitary gland. Does anybody remember what bone the pituitary gland sits in?
The Salus tursicum?
What's the name of the bone?
Oh, sphenoid.
The sphenoid bone, and the sciatica is the name of the location of that landmark. Remember that little Turk saddle in there? That's where it's going to be sitting. So sometimes people will have to have surgery down in the lower parts of their brain, and they're going to be going through their mouth, through some of the holes in their skull down that way to get to it. Because you can't let me just take your brain out for a second and then fix this and put it back in. So it's kind of cool the way that they can do these surgeries.
So that little wire, where does it start, where does it connect to?
It connects to, this is the hypothalamus.
Hypothalamus,
The
okay.
thing that looks like an eyeball over here, that's the thalamus. Hypo meaning below the thalamus. And then that's the infundibulum.
I'm sorry, is that supposed to look like an eyeball? That's where your other piece connects, right? That's not really.
There's another piece that will connect right here. It's more like a dumbbell when you have the whole thing together and everything taken apart. So you'll have one lump on this side, you'll have
Okay.
the other lump on this side, and then that will be a connection.
So it really does look like an eyeball.
Kinda.
Okay.
Well, with something sticking out of your eyeball. It looks more like this, where this thing's sticking out will actually be the intermediate masses of thalamus connecting to the other
Okay.
side.
All right.
There is another model that looks like this model that I have there, and let me see. Oh, no, that's not it, because that has all the parts. Let's see, we have like carnage going around here.
Is it that one right there?
Everywhere. There is a model just like this one, but it doesn't have the pituitary gland on it. Okay, the pituitary gland, they didn't put it on the model, so if you have a model without the pituitary gland on it, like this one doesn't have the pituitary gland on it, and you don't have the infundibulum, I can't ask you the name of the infundibulum on a model that doesn't have it. So when you're studying it, find the model that does have it so that you know what it is. Some people, you'll look at the list and then they make up stuff, okay? And then on the test, they're looking at the real thing going, I don't know, I never saw that before, because you made up something on a model that didn't have it. These guys actually have their pituitary sitting in their little muscle head. Here we go. So they have the pituitary sitting right here, okay, in the cemetery. You know, this, where that is located, so that's why they don't have it. Oops. What's that rubber band there? We're touching his nose. Anyway, so you guys got it, so look at something with that. Another thing that you might have a little confusion with is the ventricle model. Now, if you look at this, there is an indentation here. There's a little indentation here, the skinny little thing here. It gets wider here, and if I take this off the top, there is a space that's going to run over on top of this. So kind of filling out that space in here. And so those are the ventricles inside our brain. They're spaces that are going to be filled with cerebral spinal fluid. So if I were to take your brain, okay, you would be dead by the time I do this, so you wouldn't feel anything. And if I were to put it in a deep a freezer, and then I were to chip away all of your cellular material, all the white matter, all the gray matter, you would have an ice cube, or actually I would have an ice cube left of your cerebral spinal fluid. It would take this shape on, okay? So this is a mold of the spaces in your brain. So when you look at it, it's like, yeah, you can kind of
Which is the
see,
verticals.
this thing looks like a little, I don't know, seahorse head. That took on the shape here of that seahorse head. You see it? Yeah, that kind of. And then these things on the side, let me see, does this balance on here? Yeah, that balances like right here, because we'll have a space that fills that up. Okay, so this is what the spaces look like. This is the ventricle model. On the ventricle model is what I will ask you, the ventricles. I will not ask you on this model what the ventricle is, even though it's this area here, but this is also the thalamus and this is also the hypothalamus. So you're going to be very confused on the test if I ask ventricle things too on this brain. That's why the ventricles are only asked on the ventricle model. You got it? So the ventricle model. What we have on either side are the lateral ventricles. These right here are the lateral ventricles. They go off to the side. The thing that looks kind of like that little seahorse head, that's the third ventricle. This thing way down here at the bottom, that's the fourth ventricle. And what connects the third and fourth ventricle is the cerebral aqueduct. So this is the cerebral aqueduct connecting third and fourth ventricle. We'll have cerebral spinal fluid that will be floating around in there, and actually it's going to be moved along with what type of glial cells that have the cilia on the top of them. So what letter does it begin with?
S.
No. Ventricle is the name of the spaces. It's lining the ventricles. Oh my gosh.
The epidermal cells?
Yes, it's the epidermal cells. Okay, so that is the one that is going to be surrounding these and moving that cerebral spinal fluid. Epidermal. That wasn't on the list. You don't have to know that. I know that you picked that up in lecture lab. You're looking at me like
You want to sit in our lecture?
I was trying to, I'm sorry, I was trying to write while you were talking. Could you just point?
Okay, yes, I can.
Thank you.
So we got a lateral ventricle here. We got the third ventricle here. Down here is the fourth ventricle, and what connects the third and the fourth is the cerebral aqueduct. We have a picture of this in our book. I think it's on page 280. Oh, it's 284. See, they kind of made it blue, so you can see where it is. So this would be the ventricle model facing this direction. Okay? You got it? This is the ventricle model facing you, like that.
abscesses?
Nope, you do not.
I have a
Although
lot
you
of
might-
studying to do.
Hear about them when you get to the central nervous system, but I'm sure you're not that familiar.
About the flow, you need to know the flow.
But they actually are making the cerebrospinal fluid. That's
The
what it's
ventricles
doing.
do, right? The
choroid plexuses that are found in the ventricle. That's where it begins. Okay, so we have this, and you might say, oh, Professor, really? It's really weird that we have a third ventricle and a fourth ventricle. Where did number 1 and 2 go? Okay, where's the first and second ventricle?
Right.
Yeah, those are the lateral ventricles. So this is the first ventricle, this is the second ventricle, this is the third, the fourth, and the cerebral aqueduct.
Does it matter which one's first and second?
Yeah, it does. This is gonna be the first, this is gonna be the second, but if you get left and right mixed up, you're in trouble. So just call it lateral ventricle. So if you call it lateral ventricle, you
So
don't
the
have to
horns
worry
face
about it, right?
backwards, like earrings.
I just wanna tell you, it's not random that we started with third, okay? But the lateral ventricles, so you don't know, like if you're looking at, like a CAT scan and you see the ventricles, you might not know if it was facing you one way or the other, if it's the first or the second ventricle, so you'd be safe to go, yeah, those are the lateral ventricles, and we ask you, what do you think these are? You know, when you're looking at those faces. Okay, so this would be the first ventricle, second ventricle, just all lateral ventricles, third ventricle, fourth ventricle, cerebral aqueduct. Some of you guys have taken A&P before, you might have heard the aqueduct of Sylvius. Has anybody ever heard that?
Nope.
No, that's another name for the cerebral aqueduct. Sometimes what will happen is, there may be some lesions or tumors along this area, then the cerebral spinal fluid will be made and not allowed to go anywhere, so it's gonna build up pressure in here and push against the brain this way, and that's gonna be a problem. Okay, so we're gonna have to get that extra fluid out. We're gonna put little shunts in there to drain that fluid out of that cavity so that we don't have to worry about the excess pressure. Yeah.
I had a resident actually just this weekend, and they said he had a cerebral spinal fluid leak. And he had like smashed his head off the dining room table. How did that happen? Do you know? Or
He wasn't
Don't know
supervised.
exactly.
they said like, but they could tell by like it leaking out of his nose.
Right, and so if he was leaking out of the nose, I'm
Yeah.
sure somewhere in this region here,
Yeah.
because the sinus cavity is gonna be right underneath here. So he may have broken the, the meninges.
Yeah.
Might have torn, and
Yeah.
that's where the leak is going on. Now, if you're losing pressure in here, then the brain's weight is gonna kind of crush itself, and that
And
may
you have a horrible
become a
headache.
problem, and it will give you an incredibly severe headache too. So if they have to do a spinal tap, like we were talking about that last week, drawing some of the spinal fluid, you gotta stay really still till you replace it, but if he's replacing the fluid as quick as it's being lost, then he's gonna be okay until that heals, so they might have to
I don't think he
actually
was
go
okay,
in there.
but I don't think he's that. No, I don't think he's longer with us when we were waiting for the ambulance. He was actually
Yeah,
dying, but
that's awful. So anyway, we have, the ventricle mosh, we got that.
What a nice
Okay.
way to
Moving
start the
right along
class.
here. Yeah, the
That's
clear
horrible.
fluids like that should not be coming out of your ears, your nose.
Can I go back across the hall and study?
You might have cerebral spinal. Not good.
My friend had that disease, I think it was hydrocephalus.
And oh, hydrocephalus, yeah.
And she had like 4 or 5 years. There's like, she has the shuns in her stomach.
Right, and a lot of times with babies, they may be born with this, and then their heads, because they don't have the sutures, have not closed yet, they have a lot of room for expansion, so sometimes you see these babies with these huge heads, and you're thinking,
My son had a
"Holy
huge
moly,
head."
that's just not right. And so they will put in the shunts, and they will have to keep on making them bigger as they grow, so that will allow them to keep on draining that area. As an adult, if you had a shunt put in, usually they don't take it out. They'll just leave it there, even as the situation may correct. Because every time you go into that blood-brain barrier, you have an increased chance of infection. And so you don't want to mess around inside if you don't need to. Because if you get some type of pathogen in there, really hard to survive that. Yeah.
Okay, random question. Does the central sulcus somehow line up with the coronal suture? Like
Well,
just where it's located?
The central sulcus, well, the coronal suture is usually a little bit more in front of right here. But this will separate the whole frontal lobe from the parietal lobe, the central sulcus. So the brain, it's a little bit different than the skull. The skull, remember, it's going to be about here, where we call that the frontal bone. It doesn't go all the way up to the middle. So this is more midway, you can see. So I think coronal suture would be more this way. Yeah, that would be nice to line up.
That just makes sense.
Is the pineal body the same thing as the pineal gland?
Yes, the pineal body and the pineal gland are the same thing, and that makes the melatonin that is making you sleepy right now.
Awesome.
Awesome. Yeah. So,
Pineal gland is over actually.
that is this little pink little thing right here, sitting on top of the superior colliculi of the corpora quadrigemina, which sits on top of the inferior colliculi of the corpora quadrigemina. So we'll talk about that.
Okay,
Debate
I like
later
that
when we
word.
get to
It's
the sheet
pretty.
brain. You also are gonna have to know the 12 pairs
Wasn't
of
that part
cranial
of
nerves in order.
The tissue,
By next week?
the colliculi.
Yeah, of course.
Wasn't that in the lacuna? Remember that?
Okay,
Oh,
cranial
okay, I was
nerves,
like-
really easy to know the order for the cranial nerves. See where it says cranial nerves on page
280.
285
No.
in green. If you look at the second paragraph down, underneath cranial nerves, not for the whole page. Okay, about halfway through that, there's a little mnemonic device that are helpful for you remembering the cranial nerves in order. On occasion, our trusty truck acts funny. Very good vehicle anyhow. Okay, that is the first letter of each of the words plus the AEH and anyhow. Those should remind you of the first letter of each of the cranial nerves. So cranial nerves go with a Roman numeral. They also go with a name. You need to know the names in order. And they're named from the front to the back of the brain. That is the order in which they run, and that's why it's like this. Some of you guys might already know another mnemonic to remember your cranial nerves, and that is fine. You can not have to memorize this, because I'm not going to say, ooh, what does occasion stand for? Okay, I don't care about the mnemonic, I care about the cranial nerves, so you can learn them any way you want.
Tim, there's plenty of dirty ones for you.
In fact, in the old days,
Sure, I can figure something out.
I had a contest that I did one year, actually 2 years. In the first year, what we did was everybody had to come up with an original mnemonic for the cranial nerves, because of the 12 pairs in order. Then once they got that, then each lab decided which they thought was the best in the lab, and then we had a contest that all of the labs decided which was the best in the class of the mnemonic, the best one to learn, or the easiest one to learn. So the first year, everything was fine, and everybody did well. And then the second year, they got so dirty, I couldn't even read them. I don't think so, you know, so. that
Mine's not
was
that bad.
The purpose of it, I mean, I guess it was the purpose, is to remember it, but it was really a sleazy bunch that year.
You're all
And
sailors.
it was just one, it was like almost like, did you know this? Like, so anyway. You remember it any way you want, but that is, this is a clean way to remember it, okay? Anyway, so you gotta know them in order. You also have to know them by the way they go through the holes in the skull, okay? And so I have listed down here what you need to know. Now, there are two that you only two of them that you have to know on the sheep brain and the human model. And those two are the olfactory nerve, which you have the bulb is at the end of the nerve that is smell, and your optic nerve, which is here and over here, the pituitary is in the way here, that goes into your eyeball. Those are the only two that you need to know on these models, but if you, through the skull, you need to know the other ones. So on the lab test, I might ask you, what cranial nerve goes through the cruciform plate or through these little holes here? What would you tell me? Olfactory. Okay, what about in here? That's the
Oculomotor.
optic, just the plain old optic. So the optic nerve goes through here, these are the optic foramen, or the optic canals, as we call them. The superior orbital fissure, right here, that also goes into the eyeball, there are 4 of the cranial nerves that go through there. I might ask you in order, name the cranial nerves that the pipe cleaner is going through that hole. And then you'd have to have oculomotor, trochlear, trigeminal, and abducens nerve. They all have to do with something with your eyeball. Actually, trigeminal has 2 other branches to it that goes through different holes, but, you know, I'm trying to simplify this, I didn't use the one hole. I might ask you, name the, 4 cranial nerves that go through, so it has to be in order, so A would be oculomotor, B would be, trochlear, trigeminal, and C, so you got the order. And if you remember, that was the hole that they go through. The facial nerve and the vestibulocochlear nerve go through this hole right here, which is your, what is that?
Internal acoustic.
Internal acoustic meatus. Now, facial nerve goes to your face, your muscles of facial expression. The vestibulocochlear nerve, that's giving you your sense of balance and hearing. And they both happen to run through this hole. Has anybody in here had Bell's palsy? No one's ever had Bell's palsy. One of the other students had Bell's palsy. And what it was, just a temporary paralysis that she had. Bell's palsy
Your
sometimes
face,
can be
yeah.
permanent, sometimes can be temporary. But she had an infection. It started out as like an ear infection, and she woke up and she couldn't move the side of her face. And it's like, whoa, that's really weird. It's just like nothing. And
Does it
she
count
was
if it's
really
from
scared, so
Novocaine
she
at the
went to
dentist?
hospital thinking she had a stroke. And they checked her out, and she didn't have a stroke. She just had Bell's palsy, and they said it should clear up. Well, most of the time it does, in a couple of weeks, and it did. But it was the day before her best friend's wedding, to which she was the maid of honor. So she called her best friend, saying, I just got out from the hospital. I have Bell's palsy. And her friend was like, what's that? And she goes, well, paralysis of, she goes, are you contagious? She said, "No." And so anyway, she goes to see her friend at the rehearsal, and her friend's like, oh my God, you look weird, you're gonna screw up all the pictures. So
What a
she was- Yeah.
Have you ever seen somebody? It really,
Yeah.
it really
Yeah.
is quite,
Yeah,
quite
it's just
weird.
My
right?
aunt
So
has
if
Bell's
you're
palsy.
smiling on one side, the other side's just like hanging there, so she's like, make sure you turn your head, you're just gonna ruin all my wedding pictures. And so,
Like,
that's
I'll just
really
wear a veil.
funny here. If you don't know if it's gonna be permanent or not, yeah, thank you for your support.
Why does it stay permanent? Just because the infection was?
You might have fibrous tissue
Yeah.
that has grown as the inflammation, we put granulation tissue in the areas, and it might interfere with the transmission.
Because I know somebody who has it like permanently.
Yeah, so in the healing process, it
Yeah.
might have put some fibrous membrane across there and unable to send the message anymore. So that sometimes is huge. She said that hers, it was like a week later, it cleared and she was, fine. You couldn't even tell, now. But I had one of my colleagues had it, and he had Lyme disease too, and that's like not unusual to have that happen. And by the end of 2 weeks, the side of his face was so drooping that he was starting to drool.
Drool. I've had that happen to me before.
Really,
It's embarrassing.
so,
You can't talk and you bite
anyway,
yourself.
That would be, because these 2 nerves are carrying the, going through the same narrow passageway, so if you have inflammation, it might stop the transmission of the impulses. Okay, so anyway, how did we move on from there? Oh, glossopharyngeal, whenever you see the word glossal, think the tongue.
Tongue, yeah.
The pharynx is your throat. Vegas means wanderer, like Las Vegas, you're wandering through the desert to get there. it's resting, digesting, as opposed to sympathetic, which is your
Fight and flight.
fight
Come on,
or
people,
flight.
we gotta test something.
Okay. So the resting, digesting division, when that kicks in, also when you're eliminating waste to get those muscles to move, you know, when you're pooping and peeing, you gotta send messages down the vagus nerve. So if you are really nervous, to calm yourself down, pretend you're taking a big crap.
And now we'll just picture you taking a crap since you're the one who's.
Guys work in nursing homes and stuff, or, you know, the hospital, and there's certain patients that you have to toilet, and you cannot leave them alone. I mean, you gotta be there,
Yeah.
because this vagus nerve may
Vagal.
cause them to pass
It's
out.
called a vagal,
Vegas responsive.
yeah,
Right.
yeah.
And so, many people die in the toilet just because of that connection with the vagus.
They'll just be like,
Right.
it's scary.
That's what happened to Elvis. No, I'm just kidding.
I just had that today.
Oh, really?
And so if you go into the hospital, you're having cardiac issues, they're gonna give you meds to keep your heart rate down low, and they're gonna tell you, don't use the
believe you, it's just
bathroom.
funny
You're like,
that-
oh, I got it, you know, well, use the bedpan.
You're like, that's a joke, right?
Because they're afraid on these drugs that your pressure might be so low to begin with, because you're being calm, right, with the medication, you're being artificially calm. And if you use that vagus nerve, it might slow down your heart rate too much, which will cause you to pass out, and now they got a suit because you smashed your head on the floor or whatever. So that is the reason for that.
Yeah,
Okay,
exactly.
So that's, in the accessory nerve.
We got that
which
one.
will go to where you might wear some accessories like
In a
a necklace
really
or
bad
a
way.
tie or a scarf or whatever around your neck. That goes to like your sternocleidomastoid muscle, your trapezius muscle back here. Those three are going through this hole, which is your
Jugular.
jugular
Mhm.
vein. Okay, so in order, if I ask you, name the three nerves that go through that, in order, you'll tell me?
Glossopharyngeal, vagus, accessory.
Right, so make sure you go in order. So if you remember on occasion, our trusty truck Act 20 here, anyhow, you remember that. Now, remember, in that mnemonic, there are multiple ones that start with the letter A, that
And
start
O.
with the letter B, that start with a letter up, you know, so you're gonna have to know which one individually, or you're gonna mess it up. Okay, then we have the hypoglossal canal.
Is that your,
is-
like, here?
On this one, they don't even have a canal, they've got an indent in here. That is where the hypoglossal nerve will go through, and glossal means
Tongue.
tongue. So if you can stick your tongue out and bring it back in, then your hypoglossal is working. If you stick your tongue out and it goes to one side, one of your hypoglossals is working. Okay? So over Thanksgiving break, what you can do when you're waiting for the turkey because you forgot to put it in the oven, you can take your book out and you can actually test everybody's cranial nerves. Okay, it's over here.
This sounds like fun.
Okay, so there's something fun to do while you are waiting.
It really does.
Gag reflex, no, yeah, that works.
I don't have one.
Hopefully they don't throw up on you.
I've proven this to people.
So,
No, not like that.
testing your
Like,
cranial nerves,
I had a
that's
friend who,
something
like, he was in the
you'll do
armies,
with
and he
the
was like,
nursing
don't do that.
program,
But I was like, I go, open your mouth. I took a straw and I shoved it in his throat, and he nothing. And I was like,